Facebook, Instagram, and Twitter. Thank you for watching. Tim Sawyer is watching from Crystal Clear, who does my websites. They do a fantastic job. I was just there in Orlando, and he never came out to meet me. Nurse Botox joined us. Rebecca, who's now with us, and I'm going to show you one of her awesome transformations of lips. So we're going to talk about lips tonight. And Dr. Jeneby said, "Oh, hey there, Tim." But I think that's Ashley. She's decided to be one of the producers tonight.
He's my pal.
He says, "You're her pal, Tim." So Rebecca says this is her favorite topic. Dr. J, this is Brian. Hey, Brian, how's it going? Nice to see you again. I'm off topic a little bit from surgeries, but that's okay because lips have become so crazy, and I promised you that I would do something on lips. So I'm going to do something on lips. But of course, if you want to ask me anything about surgeries, if you want to ask me stuff about pre and post-op care, whatever you want to do, you guys ask me. This has been a very fantastic Q&As here. And we're going to think of something we're going to do next time. But I'm also doing something next week, and we're going to look at using different modalities for the face instead of a facelift, like heating and mini lifts and threads and things like that. So next week will be all about everything but a facelift. And what the heck camera is that right there? What is that for?
Just B-roll.
B-roll, okay. So here we go, lips. So what is a beautiful lip? Well, beautiful lips are normally full of color. Some are symmetric. Some like the lower lip larger, like mine. Some like the upper lip larger, like some people. The lip should not be the centerpiece of your face. It just is absolutely critical. Otherwise, you're going to get people who are going to laugh at you all day behind your back. And I watch Instagram. Oh, here we got something. It was great seeing you, Dr. Jeneby. Can't wait for Monday. Audrey. Thank you, Audrey. Thanks for watching from YouTube. Do not let the lip become the centerpiece of your face. It should definitely augment your face, make it look prettier. But I have seen too many disasters. We're going to show you some pictures of beautiful lips, one by Nurse Botox, another by my injector, Lonnie's been with me 5 years. No, more. We're probably going on 6 or 7 years. I'll show you one of each that I think look pretty, and then I'll show you others. So how do you get a bigger lip? So lips are very interesting part of the body. They contain a ton of blood supply. The blood supply normally comes up from the facial artery, the thyroid to the facial, then come up from the angular into the labial arteries. And as you get into these areas, you can see that in inexperienced injectors, they will hit this labial artery a lot, and experienced injectors will hit it too, but they'll know when they hit it. And they know they have to stop, and they know they have to hold pressure, ice, and just relax. And at that point, you will experience some lip swelling at that point. Don't be afraid. Don't be crazy about it. Did you just write all that? Okay, good. Don't be crazy about it because the lip will go down. It's very, very resilient. The lip starts at the oral commissure, ends up sort of coming as a sort of a slight curve all the way up to the first, what they call philtral column, or Cupid's bow, right in there, okay? Then it comes back down to form the other oral commissure. I've seen lips that end not here, not toward completely at the commissure, but a little less, and I've seen on the same person, that lip will end all the way to the commissure. Then on the lower lip, it's more symmetric than the upper lip is any day of the week, most of the time. So really, I don't worry so much about the lower lip obtaining symmetry, but all of you all right now who don't have filler, I will tell you that one of your lips is probably higher than the other part of their lips, okay? And I also measure the distance to the commissure as well as lip height in certain areas. So just to let you guys know, this is a very, very interesting place to inject because we all think we have symmetric lips and that just ain't true. This is all about lips. I'm going to show you some pictures here about lips. My buddy joined us. He's in Austin, and it's Dr. Sean Paul. If you're in Austin and you need work done on your face, go visit Sean Paul. Sean Paul, the Austin Face Doc, my good friend, joined us on Instagram. So let me just show you what we have here in lips, okay? And of course, we always have specials. So the special this time is $99 Botox or $99 Jeuveau. The $99 Jeuveau goes for the first 5 people that text in their name, email, and phone number to 210-270-8595. And somebody just texted in for the special tonight for $250 off. So you can talk to her already and tell her that we know that she's got it, and we will get to her ASAP and even tomorrow. So 210-270-85, you put 8594, by the way, on your thing. Can you put the right number? Okay, sorry, my producer here, one of my producers, executive, and then we got the other producer over there. We're gonna give you the numbers also on Instagram, 210-270-8595. And that way you can text in for $250 off your surgery tonight. And the first 5 people that text in also have a chance to get a $99 Jeuveau. So let's go again with some good looking lips. So here's a beautiful set of lips that Rebecca, our new nurse, put in just maybe a week ago. And see, so let's examine these lips, okay? There's asymmetry. This is higher, and actually it doesn't come all the way out to the commissure, it stops. This is lower, okay? And comes out to the commissure, but there's a little height discrepancy. The lower lip is actually fairly symmetric. Sorry if I'm screwing this up on what you're seeing. The lower lip is super symmetric. So what Rebecca did was, in technique, she raised the height of the right side of the lip. She raised the height of the right side of, can you turn off that? Yeah.
How much do injections typically cost?
Let's see if you can see it there, if it's not oversaturated. Oh, there you go. People want me to lift this up higher. Then you can't see my face. So let me just sneak up here. So you can see that there's asymmetries, and that the asymmetries were, the screen is up, that the asymmetries right now, as you see it right there, she fixed it by using a little extra filler right there. Sorry you can't see my face very well. I'm just showing to all the areas. And now you've got what they call a symmetric lip. She didn't need to use a lot of filler to do that. And I think these are some of the prettiest lips I've seen in a long time. And I've been putting in lips now for 17 or 18 years. So.
What's the price range?
And this, this to kind of cure lips is anywhere between $7.99 to $9.99. Occasionally we have a special on them.
And they typically last
So these typically last somewhere in the realm of 3 months to 1 year. I've seen them last. I've seen them last a little bit longer, and Rebecca's putting up that you can see more of the before and afters at spablackmedspa.com on Instagram. Sorry, not .com, but at spablackmedspa. And if you're watching on Twitter, spablackmedspa. If you're watching on Facebook, again, spablackmedspa. So here we go. We're gonna go to our next set of lips that I think are awesome. They're not as, what they call, I guess, juicy, right? But let me just get to them here real quick. And we're having a few, I'm gonna get my guy here to help me out here. I'll keep talking. And he's gonna set this up. Sometimes computers do funny things. So, as you can see, the fixing of that lip was, this lip was a little bit down. We added a little bit to the height of this lip, not on mine, but on that case right there. And I want to show you some really crazy lips that come up. You just have to, it's an automatic login. You just put enter and see if you can get that online thing to work.
Okay.
It's right over here. So what else can you do with lips? You can use filler. The number one type of filler for the lip, and really the only filler that should go in the lip beside fat or even a lip implant, is a hyaluronic acid filler. Why is that? Anybody know? Somebody's got to know. Why don't you put like Radiesse or Bilatero or things like that in your lip? Anybody know? Raise your hand. Let me know. Why? Because you can't reverse it. You have to be able to reverse these things, because let's say you were to inject and occlude the labial artery, then you'll necrose the lip. Then what they call the lip will undergo necrosis. And if it goes necrosis, it gets dark and purple. And I'm going to show you that here in a minute. So you got to be able to use a hyaluronic acid. Don't use anything dumb. I have this poor girl in my office now. She came to me about 2 weeks ago. She went across the border and she had something injected in her lips. They're all bubbled up. And I took a little bit out of one side of her lip, sent it off to pathology, and even they didn't know what it was. So this poor girl, I'm gonna have to cut the entire underside of her lip, cut out all this crazy material, which even the pathologist came back as unknown. Sorry, we'll be right there in a minute with more of the presentation. So I'm gonna have to cut out this whole area under her lip, blister by blister. Okay, we can't unplug it. Next, you can actually add fat to the lip. You can take fat from somewhere and put it in the lip. What are the downsides of having fat put in your lip? Well, unfortunately, fat can dissolve. It doesn't have, sometimes it doesn't absorb everything you want it to. I think we have to go find it again on the last opening. Sometimes it doesn't absorb exactly the way you want it to. And you just have issues with that. Sometimes the fat can form hard lumps in your lip. So be careful with fat. It has to be put in little bit by little bit, in like nano quantities, real tiny injectable quantities. And even then it's very hard. In the old days, we used to take strips of scar from like a tummy tuck or a C-section scar and put it right across the lip. Next is you can actually put a lip implant. Now, I just saw a lip implant in my office. The lip implant, and probably initially was placed across the top of the lip, but now it has migrated to the underside of the lip, and she actually needed lip augmentation for the implant. So I had to put, very carefully under sterile conditions, extra lip filler on top of an implant. So it was a very, very hairy situation, because you can actually infect the implant like that. 3, if you don't want any of that, there's absolutely no way you should get silicone into your lips. It's absolutely ridiculous, and it's hard to do, and it's really just not that good for you. I want to turn your attention to the Instagram at SpaBlack, at spablackmedspa.com, so that you guys can watch, can look at other types of lips that are awesome. And I may have to just go to my Instagram and show you. Can you just load up the Instagram onto your thing? And I will try to load up the old lips that just left us.
Sure.
He's going to load up the Instagram.
For SpaBlack?
Yeah. And I think I found the old office docs that were there. Probably, hopefully. So here's some more lips that I have here that I want to show you and highlight. So I'm going to show you these lips here. So these lips were done. Oops, sorry. So turn down a little bit of the lighting here. So you could see, hopefully you can see this, but it's sometimes this thing, there it is. The editor needs me to touch the screen. So here's the screen right here. These lips are gorgeous. Why are these so nice? It's because they were done in stages. It went from here by 1 cc and then another stage by 2 cc. And Joanna Villas, our first time watching, thank you for watching. So again, 2 cc's over the course of 6 months. This is absolutely the best way to go, is doing 2 cc's over the course of 6 months. I don't know if you can see this, if you're Twitter, but there we go.
It's working over there.
So now I think we got back to some crazy looking lips. So let me just get you guys back on. And okay, I'm gonna show you some craziness here. Okay. Anybody think that this looks good? Does anyone think that this looks good? I hope not, because this absolutely is a big lip fail. What has happened here? Someone kept going on this girl, because this is not after one session. This is after several sessions. And this is what we have, okay? Someone did not tell this girl, like, stop, okay? This is terrible, all right? Let me show you another one. So this is the type of thing that happens to you when you get silicone put in your lip. Here it comes. Okay? These are terrible blisters, okay? Terrible blistering here. This is all from silicone particles, excuse me, that are now eating through the substance of the lips. Okay? Naomi Diaz asked how much for a consultation. So I guess Ashley's working on it. So she has lip filler on this side. She has breakthrough granulomas and blistering and dry and cracking lips. Terrible, terrible, terrible. I'm just going to rotate it around for everybody. Right there. You see that? Terrible, terrible, terrible. Now you have these lips that are just almost unfixable. You'll have to cut out any residual granulomas on any one of these. Zoe Fox says yikes, and yikes is right, Zoe. So let me show you some others.
We're talking about lips right now, but we have someone that wants to know about a liquid rhinoplasty. Can you explain that a little bit?
Okay, we're going to digress just a little bit, but I got to show you this one here. This is absolutely out of control. If you see anything like this in someone's office, you run like hell out of that office, okay? Because I would never be caught dead doing this to a patient. This is absolutely ridiculous. And I don't think Rebecca, our new nurse, would be caught dead doing that, okay? Gastric sleeve, nice to see you. Awesome for coming in. Somebody asked about liquid rhino. I'm going to take a quick break, but I'm going to leave this up for a second. So liquid rhino means I'm going to take really a dorsal hump and camouflage it by adding radius to the top of here to make it a straight nose. I do not put any fluid, any injectable fillers in the tip of the nose because you can necrose it, but I do rhinoplasties, absolutely. So again, whoever wants that, just email us. Gastric 29 2017 sleeve says, hey y'all, how you doing? So look, this is not something that you want to see all the time. This is crazy. And I mean, this is just stuff off the internet. This is what people like. And I just can't believe it that this would happen like this. So let me get to another one here. Okay, this is kind of hard to watch, but so this lady had an injectable filler and it stopped up the blood supply. So I see here at Ella Cakes, I've been thinking about getting my lips done for the past year. If you go to the right person, they're very safe to get done. So eye candies, I can't let you be part of my live video, but thank you though. I know you watched a lot. So as you see here, okay, so somebody injected this lip. They got, sorry, trying to click the screen. They got a hematoma on this side. What happened is then it stopped the blood supply to the skin and the lip around it. Now the lip will heal fine, but what's going to happen here is this skin will heal with a little bit of a scar. You can see here, I'm going to rotate this around. You see that? Now I've been injecting lips for now 18 years, and thank God and knock on wood, this ain't happened yet. But because I use an injectable filler that I can reverse. This is exactly why you don't put silicone, because you can't reverse silicone. You can't put volume in your lip because it gets too, you can get it and really clot these areas so that you get this necrosis all the way up to the top of the nose almost. Now this is going to be very hard to camouflage because you've lost this lip area. Very, very hard. Okay, we're gonna move on here from that. It's gonna take a minute to catch up. So what have we done? So let's hit the lights again. I think I'm losing my stuff. Oh, there we go. So what have we learned? We learned that you need experienced injectors, and here's another thing. When you walk into a place that does not have a physician around or you don't know that the physician owns it, ask where the physician is, how far is he away, is the physician that's covering that practice trained in anything that can go wrong on the lips. A physician needs to be within 50 to 75 miles of that place so that when you get a problem, that they are there to help you. They can admit you, they know what to do, they can inject you if you get sick from it. We can help. A lot of people are opening up places and they don't have the right people covering them. And it's fun when it's fun, but when it's bad, you end up seeing a plastic surgeon anyway. So that's a plug that we have to deal with. So, and I've seen it, and I've been helping the community with lips for a long time now, over a decade. You do not want to have these lips either, as this lady has formed a little bit of an allergic response to whatever. Can have an allergic response. So if we're putting, very few people have allergic responses to hyaluronic acid. It's when you start putting like exotic stuff in your lip, like if you put Belafil. Belafil is an awesome injectable filler, but it has a little bit of bovine component, so you have to test for it before you put it in. And that's the major one. You do not put Radiesse in your lip at all. Do not put anything crazy like that in your lip. Radiesse is really good for cheeks, jaw lines, deep nasolabial fold, but it's not good for the lips. Again, this is the kind of stuff that you're going to see. And this is just some mild stuff. And my big hairy dog just walked in, the big bull mastiff, trying to figure out what's going on. Again, the worst case scenario is where you get partial necrosis of the lip. And if you get partial necrosis of the lip, you get into lots of trouble here. I mean, that is really hard to cure. Even when you get it, catch it real early, you put the hyaluronidase in, the nitrogen paste, the aspirin under the tongue. You do everything right, warm compresses. It still can go on to do full thickness necrosis, which means loss of the entire lip. This right here is preventable by not going to the wrong place. A lot of people assume that that a lot of these lip fillers are safe, and they're just not. You have to understand which lip filler you're getting, and that not all lip fillers are the same. Do not get silicone in your lips. Ask to see the package if you really need to know, or the lot number. Don't just go do medical tourism and do this kind of stuff because it's $199 somewhere. Okay, I'm treating 2 people who went across and did medical tourism to the wrong place, and this is what happened. You getting something, Ash? What are you waving at? She's just laughing. So, again, this is not good. Okay, let's look at something else not good. We're going to go back to the slides. Does anyone see... Oh, and Rebecca, our nurse, says, and don't go to hotels in San Antonio to do them either. Hey, that's really good. Yes, of course not. That's really weird. This does not look good. This is somebody who convinced somebody to run 2 or 3 cc's per lip all at once, or they went completely into 2 or 3 cc's all over the course of a couple of months. Do not do this to yourself. A normal plastic surgeon and a great injector will keep you from this problem. Yes, we had a fan, Mike Rest, said, looks like they could pop. They sure can. I mean, holy crap. Let me show you this last picture. Well, let's go back into what good-looking lips look like. Again, I'm going to highlight Rebecca's recent post. I'm going to highlight Rebecca's recent post right here. This is a beautifully done lip. Very, very, very subtle. And she should be congratulated. She works at the spa. And she's getting booked up fast. Her name is Rebecca, and she's at Spa Black. She does a very, very good job of lip asymmetries. Even I'm very impressed. This is a good-looking lip job. So this is another one at the spa. It's not loading very well, but that's okay. We'll figure it out. So, some takeaways from this. What time is it, guys? So I'm going to be doing virtual consults very soon. You go on my website, and I talked about lips today, but I can talk about anything. You want to talk about mommy makeovers, you do 3 or 4 a week. BBLs, 3 or 4 a week. And sometimes they're all in the same deal. Breast dogs, 3 or 4 a week. So we're doing a lot of these very beautiful, multifaceted surgeries, and we also offer financing. We're going to put up on Instagram to text us tonight. The first 5 texts that come in are eligible for $99 Jeuveau, and we're going to send them to Rebecca up at the spa so that she can service your $99 Botox. I think Ashley right now is talking to a few of you guys. And also, when you guys text in your name, phone, email, and ultimate referral site, then you're going to get $250 off your surgery. But start booking because we're already booking the 3rd week of November into December. We have a few slots left, so get on it. So again, watch what you're getting in that. Watch where you're going. If you need to, see the actual syringe. When you see the syringe, when you're asking to see the syringe, go ahead and ask to see where their medical director is. Is there medical in town? Is there medical out of town? Does a medical director, at least in the same field, because you could have anybody be your medical director, but they got to know that field that they're in. If there's somebody that's never touched a plastic surgery patient, probably not a good medical director. And I've seen a lot of spas open up recently that don't have medical directors that are in this field that are out of town. So it's a little scary. Always ask that because, like I said, when things go good, they're good. When things go really bad, they go really bad, and you'll see a plastic surgeon anyway, like me or one of the other awesome 50 doctors that are here in town, plastic surgeons.
Can you talk about the rhinoplasty?
Yeah. So let's go back quickly to rhinoplasty because we had a question. So the nose sometimes has a hump on it. I think I have a small little one there. To camouflage the hump, we actually add fillers here to camouflage the hump. And it's actually on my Dr. Jeneby site. So if you guys want to go to the Dr. Jeneby Instagram site, the cost is $800. We add the liquid filler in a safe spot on the nose that has little to no crossing veins. Mike Rest says, what are the odds of necrosis? In the hands of an experienced doctor, less than 1%. In the hands of an experienced injector, RN injector and above, less than 1%. But you always want to know when you walk in and you're calling, where's your medical director? Do you know how to take care of something that's going to happen? What's the type of lip filler you're going to use and how long you're going to be doing it? So you do not want to have more than 1, maybe 1.5 cc's at a time. Why? Because ultimately it's going to swell, and I think it's going to look terrible. You can always stage your lips. Do not go super huge. Super huge lips do not go to look that good. It's kind of like a BBL. Like everybody is enthralled with huge BBLs, and I always tell people, you don't need to have a big, you can tell me exactly what you want, and we'll try to put in enough fat for that procedure. You do not have to have a huge BBL, okay? So you do not have to have these big simian-looking lips. It's not good, and it'll blanch. You could get necrosis. You also want to ask if each facility is prepared for problems. So do they have hyaluronidase in the refrigerator? In each of my spas, we have an emergency kit for any filler or any lips that have a problem. And it's usually hyaluronic acid. So hyaluronidase. We even have something to remove radius called thiosulfate, which binds calcium. So I've been doing lips a long time. I'll be showing how to inject lips at the Aesthetic Academy in Dallas, November 8 and 9. I'll also be showing I'll also be moderating that on the second day and giving 2 lectures. So that's in Dallas, November 8 and 9. As for tonight, we still have our Mommy Makeover special. It's $13,999 until the end of the month. That includes a breast augmentation and a tummy tuck. That's normally about $18,000. We will finance you up to 75%, well, 75% down, 25%, and sometimes 35% financed. No credit check. We also have great specials in our spa, including chemical peels. And I think we have a buy one filler, get 20 units of Jeuveau complimentary. But for tonight, we're giving away 5 20-unit Jeuveaus for $99. Just text in to us, 210-270-8595. Can you put that up on Instagram and Twitter?
I'm putting it on Twitter right now. Instagram,
Okay.
for some reason, it's not letting me.
Oh, okay. I think I can post on here.
Okay.
Text us
210-270.
at 210, I'm doing it on Instagram right now, 270-8595 for 20 units of Jeuveau. And this is for new customers only, by the way. And for $250 off your surgery. All right, so sorry I'm kind of paying attention to this, but I think my engineer just took a break right now, or he's been drinking. Just kidding. He's doing great. We're gonna go and start doing our live virtual consults. You can get into the virtual consult room by going to my website and clicking the hamburger button at the top left. It pulls down, and then you'll see virtual consultation. And I'll be doing them up till about 8:15, and then it's time for me to go to bed for a busy day tomorrow in surgery. I will also be on the Billy Madison show tomorrow from 6:30 to about 7:15. If you guys listen to the Billy Madison show, I'm also sponsoring the Billy Madison November 15th Billy Bash at the Freeman Coliseum along with Budweiser. So enjoying it. We're going to wave at as many people we can before we leave. We are just so happy that you guys joined us. I know you had other things to do. Please come see us at the Plastic and Cosmetic Center and Spa Black for your lips. Do not go to places that have substandard stuff in them, including but not limited to no medical director within 50 to 75 miles that even knows about plastic surgery. You need to have a kit in there that in case there's emergency, that the kit's going to be available. And 3, don't let them put any silicone in your lips. Don't go to a hotel room for lips. You need to go to a sanitary, normal place like a doctor's office or a spa. Thank you guys so much. Let me know what else I can do for you.
Giveaway.
And the giveaway is Oh, and if you're on my YouTube, right? The YouTube giveaway.
Yeah, or I can put it on. I'll put the
Yeah. If you join my YouTube tonight, we are going to be giving away a facial every week for a possible, for everybody who joins the YouTube every week, we're going to do a contest for a giveaway. So we really appreciate it. Thank you guys for watching. I appreciate you. We had a great day of operating yesterday, almost close to 14 hours, and we will see you guys soon.